Macular degeneration and diabetes. Macular degeneration and diabetes are two distinct medical conditions that can affect the eyes, but they are not directly related to each other. However, people with diabetes may have a higher risk of developing macular degeneration compared to those without diabetes. Macular degeneration, also known as age-related macular degeneration, AMD, is a progressive eye disease that primarily affects the macula, which is the central portion of the retina responsible for sharp, central vision. It is the leading cause of vision loss among older adults. There are two types of macular degeneration: dry and wet. Dry macular degeneration is more common and typically progresses slowly, while wet macular degeneration is less common but can cause rapid and severe vision loss. Diabetes is a chronic metabolic disorder characterized by high blood sugar levels. It occurs when the body is unable to produce enough insulin or effectively use the insulin it produces. Diabetes can lead to various complications, including diabetic retinopathy, which affects the blood vessels in the retina. Diabetic retinopathy is the most common diabetic eye disease and a leading cause of blindness in adults. It can cause damage to the blood vessels, leading to leakage, swelling, and eventually vision loss if left untreated. While macular degeneration and diabetic retinopathy are distinct conditions, they can coexist in the same individual, particularly in older adults who have both diabetes and age-related macular degeneration. In such cases, the effects on vision can be compounded, increasing the risk of severe vision loss. It is important for individuals with diabetes to manage their blood sugar levels effectively and undergo regular eye examinations to detect and treat any diabetic eye complications early. For age-related macular degeneration, regular eye exams are also crucial to monitor the condition and initiate appropriate interventions when necessary. If you have specific concerns about your eye health or these conditions, it's always best to consult with an eye care professional who can provide personalized advice and guidance based on your individual situation. Retina therapy. Retina therapy refers to the various treatments and interventions available for conditions that affect the retina, the light-sensitive tissue located at the back of the eye. The retina plays a crucial role in vision by capturing light and transmitting visual information to the brain. There are several common retinal conditions for which different therapies may be utilized. Here are some examples. Diabetic retinopathy. The mainstay of treatment for diabetic retinopathy involves managing the underlying diabetes and controlling blood sugar levels. In advanced cases, laser therapy, photocoagulation, or injections of medications into the eye, anti-VEGF drugs, may be used to address specific issues such as abnormal blood vessel growth or swelling in the retina. Macular degeneration. Treatment for macular degeneration depends on the type and stage of the disease. For dry macular degeneration, there is currently no known cure, but certain dietary modifications, vitamin supplements, and lifestyle changes may help slow down its progression. Wet macular degeneration often requires more aggressive intervention, such as injections of anti-VEGF medications into the eye or photodynamic therapy that combines the use of light-activated drugs and laser treatment. Retinal detachment. Retinal detachment is a medical emergency that requires immediate treatment to prevent permanent vision loss. Surgical procedures like pneumatic retinopexy, scleral buckle, or vitrectomy may be performed to reattach the retina and restore proper vision. Retinal tears or holes. Small retinal tears or holes can be treated with laser therapy, photocoagulation, to create scar tissue that seals the area and prevents fluid from entering and causing further damage. Retinal vascular diseases. Conditions such as retinal vein occlusion or retinal artery occlusion may be managed with medications, laser therapy, or surgical procedures to restore blood flow and reduce the risk of vision loss. It's important to note that the specific treatment approach for any retinal condition will depend on factors such as the individual's overall health, the severity of the condition, and the recommendations of an ophthalmologist or retinal specialist. These professionals will conduct a thorough evaluation and determine the most appropriate course of action for each patient. If you suspect you have a retinal condition or have been diagnosed with one, it is crucial to seek medical attention promptly. Only a qualified eye care professional can provide an accurate diagnosis and recommend appropriate retina therapy options tailored to your specific needs. Anti-VEGF drugs. Anti-VEGF drugs are a class of medications used in the treatment of various retinal conditions, particularly those involving abnormal blood vessel growth and leakage in the eye. VEGF stands for vascular endothelial growth factor, which is a protein that promotes the growth of new blood vessels. In the context of retinal diseases, excessive VEGF production can lead to the development of abnormal blood vessels in the retina, causing vision problems and potential complications. Anti-VEGF drugs work by blocking the action of VEGF, thereby reducing the growth of abnormal blood vessels and minimizing their leakage. Here are some retinal conditions for which anti-VEGF drugs are commonly used. Wet age-related macular degeneration, AMD. In wet AMD, abnormal blood vessels grow beneath the macula, causing fluid leakage, bleeding, and vision loss. Anti-VEGF drugs are administered through injections into the eye to inhibit the growth and leakage of these vessels, helping to slow down the progression of the disease and sometimes even improve vision. Diabetic retinopathy. In diabetic retinopathy, elevated levels of VEGF contribute to the growth of abnormal blood vessels in the retina, leading to vision impairment. Anti-VEGF drugs can be used to reduce this abnormal blood vessel growth, manage swelling in the retina, and prevent further complications. Retinal vein occlusion, RVO. RVO occurs when a retinal vein becomes blocked, resulting in reduced blood flow and the potential for swelling and leakage in the retina. Anti-VEGF drugs can help manage the edema, swelling, and improve visual outcomes in some cases. Macular edema. Macular edema refers to the buildup of fluid in the macula, which can occur due to various retinal conditions. Anti-VEGF drugs are frequently used to reduce macular edema and improve visual function. The administration of anti-VEGF drugs typically involves regular injections into the vitreous gel of the eye. The treatment schedule and frequency of injections vary depending on the specific condition and individual patient response. Your eye care professional will determine the most appropriate treatment plan for you. It's important to note that anti-VEGF drugs are generally safe and effective, but like any medical intervention, they can have potential risks and side effects. Common side effects may include eye redness, irritation, or temporary visual disturbances after the injections. Your eye care provider will discuss these potential risks and benefits with you and monitor your progress closely throughout the treatment process. Some people have researched and are taking stem cell supplements. These stem cell supplements provide a boost of your own stem cells to be released throughout your body. The stem cells will attach themselves to whatever organ in your body showing weakness or damage. I myself have been experiencing blindness in my right eye. I have had anti-VEGF injections and have been taking stem enhanced products. I hope this information helps. If you enjoyed my video, please click the subscribe button to my channel. I will keep adding videos as I can. Thanks for visiting.